The truth about self-medication in Nigeria. Self-medication is a widespread practice in Nigeria. While it might seem like a quick solution, it's riddled with dangers that can have lasting effects on your health. Here's why you should think twice before taking medications without consulting a doctor. 1. Misdiagnosis. When you self-medicate, you might be treating the wrong illness. For instance, malaria and typhoid share similar symptoms, but they require different treatments. Misdiagnosing yourself could mean taking drugs that don't address the actual problem, allowing the condition to worsen and possibly causing complications. 2. Drug resistance. Overusing antibiotics is a major cause of antibiotic resistance. For example, taking antibiotics for viral infections like the common cold is not only ineffective but also contributes to the rise of superbugs, bacteria that no longer respond to standard treatments. This makes future infections harder and more expensive to treat. 3. Overdose or underdose. Without proper guidance, you may take too much or too little of a medication. For instance, overdosing on paracetamol, a common pain reliever, can severely damage your liver, while underdosing on antimalarial drugs might leave you vulnerable to a relapse. 4. Side effects and allergic reactions. Every medication comes with potential side effects. Self-medicating without understanding these risks could expose you to harm. For example, non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen can cause stomach ulcers or kidney damage if misused. Worse, an allergic reaction to certain drugs could become a life-threatening emergency. 5. Masking serious conditions. Self-medication can mask symptoms of more severe health issues. Taking painkillers for frequent headaches might relieve the pain temporarily but delay the diagnosis of a brain tumor or meningitis. Early detection often makes a huge difference in treatment success. 6. Drug interactions. Mixing different medications without professional advice can be dangerous. For instance, combining blood pressure medication with certain over-the-counter painkillers can result in reduced efficacy or harmful side effects. Only a doctor or pharmacist can properly evaluate potential interactions. 7. Addiction and dependency. Some drugs, such as sleeping pills or cough syrups containing codeine, can be addictive if used improperly. Self-medicating with these substances can lead to dependency, affecting your overall well-being and mental health. 8. Wasted money and time. Self-medicating often leads to spending money on the wrong treatments. Worse still, it delays proper diagnosis and treatment, costing you more in the long run. Imagine buying multiple malaria treatments only to discover your symptoms were due to a completely different condition. Why you should consult a doctor. Doctors are trained to diagnose and treat illnesses accurately. They consider your medical history, allergies, and current medications before prescribing the best course of action. Pharmacists can also provide guidance on over-the-counter drugs and their proper use. Seeking professional help might cost more upfront, but it saves you from potential health crises and long-term expenses. In conclusion, self-medication might seem convenient, but the risks far outweigh the benefits. Next time you're tempted to treat yourself, remember, your health is worth the investment. Always consult a healthcare professional for the best care. If you found this post helpful, don't forget to like, share, and subscribe to stay connected for more educational posts like this.